Now, what about if place can make you happy, can it also make you well? There's a landmark study published in 1984 by Roger Ulrich where he looked at patients who were having gallbladder surgery. They were being operated on by the same doctors, had the same nursing staff, they had the same, everything was the same, except some had a view of a grove of trees out the hospital window and some had a view of a brick wall. And what he found was that the patients who had the view of the grove of trees left hospital on average a day sooner, needed less pain medication, and had fewer negative nurses' notes, in other words, they were in a good mood, than the patients with the view of the brick wall. And again, as I've said, this has been repeated over and over again in many circumstances, that somehow views of nature seem to be calming and beneficial, not only to your moods, but beneficial to your health. So there are elements of place which can stress and elements of place which can calm. Elements of place which can stress are noise, light, too much, too little, temperature, humidity, too much, too little, crowding, odors, and mazes. And elements that can calm are calming sounds, diffuse light, comfortable temperature and humidity, beautiful views, views of nature, fragrances, and labyrinths. So there's a difference between mazes and labyrinths. In a maze, you can't see where you're going, and you come to many decision points, and that's extremely stressful. When I was writing my book, Healing Spaces, my editor told me, you've got to put something in there that the young people will appreciate. You have to read Harry Potter. How many of you have read Harry Potter? Okay, a fair number. So in The Goblet of Fire, chapter 4, there is an incredible description of a maze, of Harry Potter in a maze. And it's dark, and he can't see where he's going, and there are goblins and monsters behind every turn, and he's lost, and it's a tremendously good description of the stress response in a maze. Now, on the other hand, a labyrinth, and I'll show you a picture a little later on, is a pattern on the floor. In the book I describe labyrinths. It's a fascinating thing. There are labyrinths all over the Mediterranean, actually all over the world. They've been there since Viking times, certainly in Roman times. And in the medieval times, labyrinths were used in churches for a walking meditation. So how many of you have walked a labyrinth? Wow. Okay, I know the labyrinth at St. Philip's in the Hills. How many of you have been there? No, okay, I'd be interested afterwards. Well, maybe we can take a poll afterwards by email of what labyrinths there are around here. I'd be interested to know. But you can go on the web and look up labyrinths near you and find a labyrinth that you can walk to calm yourself. And it gets you in, it's gentle exercise, and it allows, you don't have to think because you just follow the path. And so that's like a walking meditation. If you are stressed, chronic stress does cause illness. Chronic stress is associated with more severe and more frequent viral infections. Decreased vaccine take rate. So if you are a caregiver of a loved one and you want to protect that loved one from getting the flu, so you go out and get your vaccine and your flu shot, but if you're stressed, there's going to be a lower take rate for that vaccine. So you're not doing your loved one any good by not doing things to help reduce your stress. So chronic stress also speeds chromosomal aging. It speeds cancer growth of certain cancers, and it slows wound healing. Now, stress does not cause these conditions. Stress does not cause the flu bug causes the flu. Stress does not cause wounding causes wounding. Stress does not cause cancer, your genes and environmental exposures cause cancer, and it doesn't cause aging causes aging. However, stress, through the stress hormones that are released, like cortisone, impair your immune system's ability to do its job to heal to protect against cancer, and to slow aging of chromosomes. So it doesn't make sense to take a person who is already stressed and already sick and put them into an environment like a hospital that will make them more stressed and more sick. So that's what the Institute on Place and Wellbeing that I've established here at the Center for Integrative Medicine, College of Medicine, College of Architecture, Planning, and Landscape Architecture is all about. And I'll tell you more about that as we go forward. But let's talk about what elements can be incorporated into building design of all types: hospitals, schools, urban design, offices. This is the Diamond Children's Hospital, an absolutely spectacular example of a beautifully designed hospital that is a healing space. How many of you have been into the Diamond Children's Hospital? It is calming when you get in there. It is calming when you sit in the waiting room, even outside the intensive care unit. You have views of the Santa Catalina Mountains, and it is designed thoughtfully so that the children can play with interactive elements on the walls. This is a TUCSON Medical Center, again, with interactive elements on the walls where the kids can play. When I was taking these pictures, the parents wanted the little boy to leave, and he wouldn't leave. He was so busy playing with the wall. This is an international movement in hospital design. This is Korea. This is a children's mental health facility, which does not look like a mental health facility because there's stigma attached to that, particularly in Korea. And so there's an attempt to make it look more friendly and less like a hospital. This is the view of the Santa Catalina Mountains from TUCSON Medical Center. TUCSON Medical Center also has some beautiful patios where the nursing staff have competed with planting. Anybody from TUCSON Medical Center? Somebody's smiling over there. Hi. They didn't pay me for this. I just think it's a beautiful, beautiful patios, which are designed, again, hummingbird patio. This is a children family patio. Now, how many of you would like to have that view out your window for 8 weeks? No. Unfortunately, that is the view out the window in the bone marrow transplant unit at the Dublin St. James Hospital and Trinity College, Dublin. It's a 200-year-old Dickensian workhouse that was converted into a hospital. And in order to put in the positive pressure flow to protect the bone marrow transplant patients from infection, they had to put in this whole HVAC equipment outside the windows. And when you have a bone marrow transplant, you're stuck in that room for 8 weeks. Nobody can come in, you can't go out. And so Professor Sean McCann wanted to do something for his patients. He didn't have much money, and he hired a painter. The painter talked to the patients and asked, what would you like to see? And so this is what they did in the hallways, which to me didn't do anything for me. But anybody from Britain? Ireland? No. These are the football colors of the Irish football teams. And the patients loved it, and they were able to talk about it, and it took them away from their pain. And then he installed an LCD projector to project various images on the wall so that the patients who were really very ill could just click and see the images that they wanted. And relating to your comment about home, what he did is he had a committee at the hospital, and they interviewed the patients and asked, what would you like to see? The vast majority wanted to see views of nature. But they also wanted to see views of home. And there was one patient who liked to walk his dog on Dunleary Pier and watch the boats go by. And so they worked with the city of Dublin to install a webcam so that the patient could watch in real time the boats going by. And some people wanted to see their families in that way. So technology can be used nowadays to, this is just some of the images that they use. What he found in those patients, there was significant reduction in anxiety, significant reduction in depression, and significantly improved quality of life with a simple intervention. This is a labyrinth. This is the Walter Reed National Military Medical Center in Bethesda. Used to be the Navy Hospital, then Walter Reed Army and Navy merged, and it's the Walter Reed National Military Medical Center. Before I left and came to Tucson, we began a study which we're still involved with now, and I'll show you a bit more later. But this is the NICOE, the National INTREPID Center of Excellence at the Walter Reed National Military Medical Center. And they put in a labyrinth. Now, how do you get these tough guys to walk a labyrinth? I mean, seems a little woo-woo. But this labyrinth is installed right outside the physiotherapy department. And it helps with balance. You know, when you have to walk, you relearn balance. And these are often amputees. They're young men who have to relearn balance. And so they get into the labyrinth and they find out, wow, this is calming. And so they start using it. And in fact, the staff and the family use it too. So the NICOEs across the country, there are now going to be 6 National INTREPID Centers of Excellence for Wounded Warriors across the country. They're all installing labyrinths. So what about senior housing? Place can be used to support individuals whose memory is failing. And the reason is when you have Alzheimer's, the first part of the brain that starts to go is your memory of place. So if you can do things in the environment to help reduce the need to remember where you're going, you can make people more independent for a longer period of time. Healthcare designers call this mental prostheses. This is a senior housing community in New Canaan, Connecticut. And you can see it looks awfully like Disneyland, like the main street of Disneyland. And that's totally on purpose because the designers worked with the community and they said, our people grew up with main streets. We want a main street so they feel at home. So there's familiar setting is important in reducing anxiety. Landmarks like that big clock and the lamppost also are navigation aids that help when people have lost memory for place. There's areas of social support, views to daylight, so that if you can't remember if it's breakfast or dinner, if it's dark outside, you know, okay, it must be dinner, and if it's light, it must be breakfast. So people are less anxious and more independent for longer with simple interventions. There are many studies, this is by Robert Wood Johnson Foundation, who found that there are many aspects of health that are improved by implementing these kinds of interventions in place. And what's good for people is good for the bottom line. Again, Robert Wood Johnson Foundation calculated that it cost up to $12 million extra. Here's the financial case. I'm looking at Bill. So up to $12 million extra to build such a fable hospital. What they did is they looked at hospitals where wings were being retrofitted, and they actually calculated how much it would cost to retrofit the emergency room or the cardiovascular unit or the intensive care unit with these kinds of interventions. And then they calculated how much was saved in the first year of operation. Almost all the money that was spent up front was saved in the first year of operation because of less nursing turnover, fewer medical errors, fewer hospital day stays for the patients, and so on. So there is a real financial case for using place to help in healing and well-being. So can it also impact performance? So the stress response is important for performance. If you are on task, on deadline, working on a job, when I have to speak, I have to get a little stressed in order to have my focused attention. You know, it's the stress response working for you that helps you to perform on task. And oh, that's terrible. Wow, it knew that I had to be stressed. Sorry. So this is a question that is asked to us by people who are designing office spaces. And we've been working with the General Services Administration that builds and maintains all federal buildings in the United States. That's 2.4% of all buildings in the United States are built and maintained by the GSA. And in 2010, when I was at the National Institutes of Health, we did a study with the GSA where we looked at a building that had been retrofitted, and we compared the stress responses in people in the old space to the new space. And we found that, in fact, the people in the new space had lower stress responses on two completely separate measures of the stress response, even though they were not subjectively aware of it. So this is the headquarters of the GSA, which is a very beautiful building, and we're continuing to work with them. This applies to schools as well. This is the Manzo School here in Tucson, where they have a wonderful farm. We had the opportunity to visit it a few months ago. And look at the faces on those children, just say it all. This is the Sonoran Landscape Garden, the Underwood family Sonoran Landscape Garden outside the College of Architecture, Planning, and Landscape Architecture. And students gravitate to sit in this beautiful shaded area that has, if anybody hasn't visited it, I would recommend that you go. 5 different desert ecosystems in there and maintained with water that just comes off the roof. And this used to be a parking lot. Urban design, same thing. I'm not going to spend more time because I've spoken a long time, but putting in green spaces, walkability is very important in areas for social support. This is the last piece of evidence that I'm going to show you, which is that the work we're doing on the Walter Reed National Military Medical Center, this is the urban street that the wounded warriors have to walk along to get from their housing on the base to the hospital. And we are working with the Navy to retrofit this woodland area along the branch of the Rock Creek Park to be ADA accessible and have spaces for contemplation and social interaction. It's called the Green Road. It just opened in the fall, and we're going to be doing the studies on this area to measure the stress response or the reduction of the stress response in the wounded warriors as they walk along this road as opposed to the urban, noisy one. One of the interesting things that in focus groups with the troops we found is that they say what are the things that they like about this woodland area. It's seeing not only nature but the animals in it. There's something about being one with the rest of the universe that is calming. There are again scientific studies that show that simple walking 30 minutes a day, mindfulness meditation 3 times a week, and a healthy Mediterranean diet will actually slow that effect of stress on your chromosomes. Chronic stress makes your chromosomes look 10 years older than your biological age. If that's not a reason to do something about stress, I don't know what is. But I don't want you to think that if you can't manage your stress response, you've failed. That's not the message. Because it's, you need a coach, you need help to do it. That's what integrative medicine is all about. Helping people to change their lifestyle, to have a healthier lifestyle, and healing spaces and healing places are part of that integrative approach. So the challenge is proving whether, when, and how the environment affects well-being. That's why I've established this Institute on Place and Well-being, bridging many colleges across the campus, but mainly the Center for Integrative Medicine, the College of Medicine, and the College of Architecture, Planning, and Landscape Architecture, and now we're working also with the College of Engineering. And our goal is to be able to measure in real time all of the environmental exposures that you walk through and link them to measures of health and well-being. So that's really what we're doing, and we're at a place in time which is absolutely wonderful because we have these wearable devices that can help us do this. We're also developing ways to measure biomarkers in sweat. That's a whole other story, but ultimately what will be done with that is we will be able to measure all kinds of molecules without having to draw blood. So this is the new frontier of mobile health, mobile place and well-being, new frontier of green design. It's the new frontier of, there's an economic case for designing spaces that are healthy. We've briefed the Surgeon General's office on this. There's a push across the federal government and other entities such as the Vatican. I spoke at the Vatican about 4 years ago and had an audience with Pope Benedict, because the Vatican is very interested in bringing these concepts into the Catholic hospital system. There are 120,000 hospitals around the world that are run by the Catholic healing orders. And the question they asked is, how do we do this for our patients? So you can create your own happy and healing place. You can read about it in my book. One of my favorite places is the Bishop's Garden at the National Cathedral in Washington, D.C., but there are many, many other places that are healing, and you can find them for yourself. So I think I'm going to stop here and take questions. Thank you.